Hi, I'm Evan. I'm the occupational therapy student that's going to be working with you today on wrapping and caring for your residual limb. So I'll be using a water bottle to represent a residual limb. And first, what you want to do is look over your residual, see if there are any new areas of skin breakdown, meaning, any open or new wounds or cuts. If you have stitches, we want to make sure that those are, properly taken care of. We want to make sure that the area isn't wet, that there's no redness or irritation. And what we can then do is start to massage the end of the residual limb. So we're gonna feel that softness at the bottom of the residual, and we're gonna start to sort of move that around and mobilize it to work the underlying tissues and musculature of the residual. After doing that, what we can do is press it down on the end of a table, and you're gonna press only to the point where you can handle it. If you're feeling any pain, obviously stop, and you're gonna press down and just move it around a little bit, forward and backward and side to side, just so that you can sort of again move some of that squishier skin at the bottom there around. Another way we can do this is by using a towel over the end of the residual, and we're gonna pull it up and down to get some nice pressure over the end of the residual. Next, we're going to talk about wrapping with an ACE bandage. So when wrapping, we want to position the residual in the extended position. So you don't want to have it bent and flexed. You want to have it all the way open. And like I said, I'll be using the bottle here. We're going to take an ACE bandage, and you're going to first start by making a U shape. So going around the base of the residual in a U pattern here. You can see the two sides of the U. And then what you're gonna do is bring the ACE around and sort of make a T shape, keeping it taut the entire time. Little bit difficult here with the water bottle, but you can see how you have this T shape. And then after the T, what you're gonna do is go in a figure 8 pattern, crossing over each time to fill in the gaps between your skin and the ACE bandage. So we're gonna bring it down and around and twist it, making sure to fill in all of those gaps as we go. So another thing to think about while we're doing this, you don't want to have the area be wet at all. That the moisture will actually cause some problems. We also want to make sure that we're not doing it too tight, because if we do it too tight, we're going to cut off circulation. Also, lastly, we don't want to end with the ACE bandage being in a joint. So we want to make sure that we're ending, sort of in the middle of the limb. And what we're looking for is this nice crosshatch pattern here, where we're going, around and down with that figure 8 pattern. And now a gap like this at the top, again, that's not going to be, that's not ideal. But because this is a water bottle and not a very long ACE bandage, it's a little bit difficult to fill in everything. But as long as you have that nice cross-hatching pattern, and if you had a longer ACE bandage, you could cover in all of those different areas. It's definitely important to make sure we're checking all of the skin. If you can't see an area, you can use a mirror to put down and look at different areas to make it a little bit easier for you. And this is so important for any occupations or things that we like to do throughout the day where we have to walk or put weight down on the residual. So standing to go to the bathroom, or standing at counters to cook or anything like that, are where this is going to help you out. So keep those things in mind while you're working, and I'll see you next time. Bye.